this is Dr. Scott Kilgore, the Video Foot Doc, here with another video for you on all things foot and ankle. Today I'm going to talk about sesamoiditis. Sesamoiditis is essentially inflammation of one of two small bones located in the foot called the sesamoids. Now everyone has these two small bones. They basically appear underneath the big toe joint on the bottom of the foot. The actual location of these two bones is actually underneath the head of the first metatarsal bone, which is actually the base portion of the big toe. These particular bones have a very important anatomical role in helping to distribute pressure and stress across the first metatarsal as one walks. These structures can become injured in a wide variety of different ways. It's very common for runners to develop sesamoiditis due to the constant pounding and joint motion that occurs at this site, and it's also common for people with repetitive type activities such as jumping off of platforms, climbing on ladders, using heavy pedals, other sorts of things which can create direct pressure to the sesamoids themselves. Certain injuries can also result in sesamoiditis, including injuries that force the big toe joint either upward or downward, which causes stress and strain to one of those sesamoid bones. Now, the symptoms of sesamoiditis can vary, but most often the symptom is sort of a sharp pain that's located directly underneath the big toe joint on the bottom of the foot. It can also sometimes present simply as a dull ache or just simply a feeling of pain or discomfort that's not very describable. But mostly this is felt when one is walking on their foot, and is usually felt more so when one is barefoot rather than wearing shoes. Or at least when they're wearing supportive shoes. It can also be felt a little bit more strongly when one is wearing something less supportive, like a flip-flop sandal, for instance. Sesamoiditis is a condition that's not too difficult to treat when caught in its earlier stages. Basically, treatment involves trying to reduce the actual direct pressure to the bottom of the foot to reduce direct strain on the sesamoid bone to allow essentially the inflammation within the bone itself to heal. This can be accomplished through a number of different means, which can include simple padding that will take weight away from the sesamoid area, all the way on up to an orthotic, which helps to redistribute pressure across the ball of the foot, and even sometimes the use of a pneumatic walking boot, which actually takes away the majority of the pressure that is underneath the big toe joint during the walking cycle, and when one actually places weight on their foot. More advanced cases sometimes would actually need to be immobilized in a cast with the use of crutches to support the foot, but I don't see this too frequently, or at least the need for the immobilization is not too frequent in most of these cases. Sesamoiditis also can be treated with anti-inflammatory medication to try to actively reduce the inflammation, and this can include non-steroidal anti-inflammatory medication, either over-the-counter or prescription, and also includes techniques such as icing, which help to reduce the inflammation as well. Occasionally we have to inject a steroid compound into that region to try to decrease the inflammation of the sesamoid when other techniques aren't working as well. However, one must be careful, because if a stress fracture or stress reaction is present in the sesamoid bone, this can actually make things a little bit worse with the use of steroid medication, because that can actually decrease the ability for those types of injuries to be able to heal properly. And so use of steroid medication is not the best idea if that's a concern. I'll talk about stress fractures and stress reactions, as well as outright fractures of the sesamoid bones in another video. When one gets rid of their sesamoiditis, certainly there is the potential for that condition to return again if the chronic activity is still going to take place. And so therefore, sometimes special consideration needs to be made towards either reducing one's activity, which is creating the inflammation in the first place, or simply being more careful, such as using more supportive shoes, better shock absorption underneath the sesamoid area, and also using an orthotic insert to help decrease the strain to the bottom of the big toe joint, which can help to decrease the pressure to the sesamoid area. Now, when conservative treatment techniques do not work and pain continues to be present due to sesamoiditis, and the condition is simply not going away with immobilizing the foot or reducing the pressure to the sesamoid or using medication and anti-inflammatory techniques, then more aggressive means need to be taken in order to get rid of the pain, as sesamoiditis can become a rather chronic and debilitating condition if it's not resolved. The more aggressive way of treating this is essentially to remove the sesamoid bone that's inflamed through surgery. In general, this relieves all the pain and basically leads one to not have any more symptoms. However, removing a sesamoid can place a moderate risk to the big toe joint of some instability. The sesamoids do have a role in the stability of the big toe joint and its function, and when you remove one of those bones, there is a chance that there could be some moderate or mild deformity that could develop in the big toe itself, either raising the big toe or allowing the big toe to swing over one direction or the other. In general, this risk is not strong, but it's still possible, and unfortunately it sort of must be taken into consideration when operating on this particular area. However, the risk of this potential deformity is significantly less important than the need to reduce pain and reduce the ability to be able to function again by removing the sesamoid and relieving the pain from the condition. Well, I hope you enjoyed watching this video. Please look for more videos on all things foot and ankle on this site as well as others, or you may check out my website at www.inpodiatrygroup.com. Thank you.